Cirrhosis is a chronic liver disease characterized by extensive scarring and fibrosis of the liver tissue. It represents the end stage of progressive liver damage caused by various underlying conditions. Cirrhosis is a condition wherein normal liver tissue is replaced by scar tissue, disrupting the liver's structure and function. The liver is a vital organ responsible for numerous essential functions, including detoxification, metabolism of nutrients, production of proteins, and regulation of biochemical processes in the body. Several factors can lead to the development of cirrhosis, including excessive and prolonged alcohol consumption is a leading cause of cirrhosis in many parts of the world. Alcohol abuse can lead to inflammation of the liver, alcoholic hepatitis, which over time progresses to cirrhosis. Hepatitis B and C viruses can cause chronic infection of the liver, leading to ongoing inflammation and liver damage that can progress to cirrhosis if untreated. Non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. These conditions are characterized by the accumulation of fat in the liver, steatosis, which can progress to inflammation, steatohepatitis, and ultimately to cirrhosis in some cases. In autoimmune hepatitis, the body's immune system mistakenly attacks the liver cells, leading to inflammation and potentially cirrhosis if untreated. Certain genetic conditions, such as hemochromatosis, excessive iron accumulation in the liver, Wilson's disease, excessive copper accumulation, and alpha-1 antitrypsin deficiency, can predispose individuals to cirrhosis. Conditions affecting the bile ducts, such as primary biliary cholangitis and primary sclerosing cholangitis, can lead to cirrhosis due to impaired bile flow and liver damage. The progression of cirrhosis involves several stages, beginning with liver injury and inflammation, followed by fibrosis, scarring of liver tissue, and eventually leading to the formation of nodules of scar tissue within the liver. These changes disrupt normal liver function, leading to complications that significantly impact health and quality of life. Cirrhosis can manifest a wide range of symptoms, which may vary in severity depending on the stage of the disease and the underlying cause. Common symptoms include persistent tiredness and lack of energy are often early symptoms of cirrhosis, reflecting the liver's impaired ability to metabolize nutrients and toxins. Yellowing of the skin, whites of the eyes, sclera, and mucous membranes occurs due to elevated levels of bilirubin in the bloodstream, a consequence of impaired liver function. Fluid accumulation in the abdominal cavity, leading to abdominal swelling and discomfort. Ascites occurs as a result of portal hypertension, increased pressure in the veins supplying the liver, and reduced albumin production by the liver. Reduced production of clotting factors by the liver can lead to easy bruising and prolonged bleeding from minor injuries or mucosal surfaces. Intense itching, particularly on the hands and feet, is common in cirrhosis and is believed to be related to the accumulation of bile salts in the bloodstream. Cirrhosis can cause symptoms such as nausea, vomiting, abdominal pain, and changes in bowel habits due to disturbances in digestion and absorption of nutrients. Cognitive symptoms ranging from mild confusion and forgetfulness to severe disorientation and coma can occur due to the buildup of toxins, such as ammonia, in the bloodstream that affect brain function. Electrolyte imbalances, particularly low potassium levels, can cause muscle cramps and weakness, affecting physical strength and endurance. Diagnosing cirrhosis involves a combination of clinical evaluation, laboratory tests, imaging studies, and sometimes liver biopsy to assess the extent of liver damage and determine the underlying cause. Diagnostic approaches include healthcare providers evaluate symptoms, risk factors, such as alcohol consumption or viral hepatitis, and conduct a thorough physical examination to assess signs of liver disease. Blood tests such as alanine aminotransferase, ALT, aspartate aminotransferase, AST, alkaline phosphatase, ALP, bilirubin levels, and albumin levels are commonly performed to assess liver function and detect abnormalities. Ultrasound, computed tomography, CT, or magnetic resonance imaging, MRI scans may be used to visualize the liver's size, shape, and structure, as well as to identify signs of cirrhosis, such as nodular liver surface, splenomegaly, or ascites. This non-invasive test measures liver stiffness, which correlates with the degree of liver fibrosis. It is used to assess the severity of liver damage and monitor disease progression over time. In some cases, a liver biopsy may be recommended to obtain a tissue sample for microscopic examination. This helps confirm the presence and extent of cirrhosis, assess liver cell architecture, and identify the underlying cause of liver disease. While cirrhosis is a chronic and progressive condition, treatment focuses on managing symptoms, slowing disease progression, and addressing underlying causes to improve quality of life and reduce complications. Treatment approaches include, depending on the cause of cirrhosis, such as alcohol cessation, antiviral therapy for hepatitis B or C, or management of metabolic disorders. Addressing and treating the underlying condition are critical to halting disease progression. Adopting a healthy lifestyle that includes a balanced diet, regular exercise, and abstaining from alcohol and recreational drugs can help reduce liver damage and improve overall health. Certain medications may be prescribed to manage specific symptoms and complications of cirrhosis, such as diuretics for ascites, lactulose, or antibiotics for hepatic encephalopathy, and medications to relieve itching or improve bile flow. Nutrition counseling and supplements may be recommended to ensure adequate intake of essential nutrients, particularly in individuals with poor appetite or malabsorption. Regular medical monitoring, including liver function tests, imaging studies, and screening for liver cancer, hepatocellular carcinoma, is essential to detect complications early and adjust treatment accordingly. Procedures such as variceal band ligation or sclerotherapy may be performed to manage bleeding from esophageal varices, a common complication of cirrhosis. In cases of advanced cirrhosis with liver failure and significant complications, liver transplantation may be considered. This surgical procedure involves replacing the diseased liver with a healthy liver from a deceased or living donor. Cirrhosis can lead to several serious complications that significantly impact health and require careful management. Increased pressure in the portal vein and its tributaries due to liver scarring can lead to complications such as varices, enlarged veins, splenomegaly, enlarged spleen, and ascites. Accumulation of toxins in the bloodstream, particularly ammonia, can impair brain function and lead to cognitive symptoms ranging from mild confusion to coma. Chronic liver inflammation and cirrhosis increase the risk of developing liver cancer, necessitating regular surveillance with imaging studies and alpha-fetoprotein blood tests. Fluid accumulation in the abdomen, ascites, can lead to infections such as SBP, a serious complication requiring prompt antibiotic treatment. Impaired kidney function due to advanced cirrhosis and severe portal hypertension can lead to hepatorenal syndrome, a life-threatening condition requiring intensive medical management. The prognosis for individuals with cirrhosis varies depending on several factors, including the underlying cause of liver disease, the extent of liver damage, degree of fibrosis and nodularity, and the presence of complications. Early diagnosis, adherence to treatment recommendations, and lifestyle modifications can significantly improve outcomes and quality of life. Cirrhosis is a complex and potentially life-threatening condition characterized by progressive liver scarring and impaired function. Early recognition of symptoms, prompt diagnosis, and comprehensive medical management are essential to slow disease progression, reduce complications, and improve long-term outcomes. Advances in treatment options, including liver transplantation, offer hope for individuals with advanced cirrhosis. Continued research and public health efforts are needed to enhance understanding, prevention, and management of this challenging liver disease. By raising awareness and promoting early intervention, healthcare providers and individuals affected by cirrhosis can work together to optimize care and support for those living with this chronic condition. This comprehensive guide provides a detailed overview of cirrhosis, covering its causes, symptoms, diagnosis, treatment options, and management strategies. For individuals affected by cirrhosis and their caregivers, understanding these aspects of the disease is crucial for effectively navigating its challenges and improving quality of life. In conclusion, cirrhosis is a serious liver condition that demands attention and proactive management. By understanding its causes, recognizing early symptoms, and seeking timely medical care, individuals can significantly improve their quality of life and prognosis. Whether through lifestyle adjustments, medical treatments, or, in severe cases, liver transplantation, there are avenues for managing cirrhosis effectively. Stay informed, stay vigilant, and together, we can empower ourselves and our loved ones in the fight against this challenging disease. Thank you for watching, and remember to subscribe for more informative content.
Bye.